levels of government. Folks and friends like Len, who knows the issues of our shore communities and economies better than anyone else. I mentioned the other day that we had a great conversation with both the 4 shore counties and a number of the municipalities and mayors just a couple of days ago, earlier this week. I also want to give a shout out to some other folks. Senator Vin Gopal, who represents so many of our great Monmouth County beach towns. His advice and counsel and advocacy for our shore towns was similarly invaluable. I also give a shout out to another friend, Monmouth County Freeholder Director Tom Arnone. I also, just by example, and again, Monmouth's my county, so I'll brag, Mark Walsifer and his team in Belmar put forward, in particular, a really smart beach plan. And I want to thank all of the other local and county officials from up and down our coastal communities. This was truly a collaborative process, again, not just Monmouth and Ocean and Atlantic, but obviously Cape May, represented by Len today. We want everyone to have fun, but we need everyone to be safe. To accomplish both, we will be requiring restrictions on how many beachgoers may be allowed on any beach or lakefront. And the social distancing we've been practicing in our hometowns will be extended to our beaches. And to be clear, no one will be discriminated against. No community can turn a public beach into a de facto private one. All visitors must have the ability to enjoy our state's greatest natural resource. Every beach will be required to establish capacity limitations, but we will leave it to local leaders to determine the method that would be best for their community. This can be done through methods including limiting the numbers of available beach tags for any given day, or through utilizing technology such as with a geographic spatial analysis. Social distancing measures requiring at least 6-foot distances between beachgoers will be enforced except for family groups, household members, caretakers, or couples. This is the same approach we have taken with parks. And again, we will leave it to local officials to determine how best to implement these measures. Each of our shore and lake communities have unique characteristics, and we know there is no one-size-fits-all approach. However, some restrictions do fit across the board. Organized games and contact sports will be prohibited, as will beach recreational summer camps and special events that draw people to the beach, such as concerts, festivals, or fireworks. Sanitation will also be of great importance, especially since this order will allow for shower pavilions, changing areas, and restrooms to remain open for visitors, and they must be regularly and properly cleaned. And with this order, I am also directing the reopening of restroom facilities at our parks, so long as they undergo frequent and proper cleaning as well. Commissioner of Department of Environmental Protection, Catherine McCabe, Matt Platkin would want me to remind everybody that it will take a while for us to roll through with the proper seasonal staffing to get all those restrooms up and running and open and properly sanitized. So at the parks, please bear with us. That will begin, I think, as early as Saturday, but it's going to take some time. On our boardwalks, restaurants may continue to operate for takeout and delivery only, but the rides, arcades, games, and other draws must remain closed. Other features that are meant to draw a crowd, a waterfront fountain, a playground, or visitor interpretive center must similarly remain closed for the time being. This is not a life sentence here. We could have a dramatically different reality a month from today. And I promise you, we're going to monitor this for both sides, by the way. We've got to comply, folks. You've been extraordinary. We've got to continue to comply now at the beach. And assuming we do, and assuming the curves keep getting better, and assuming Judy and her team feel comfortable, we will be able to take more steps. And I promise you, we will not hold those steps back 1 minute too long, nor will we jump the gun, I hope, not 1 minute too soon. Our beach and lakefront communities and counties will also engage in comprehensive public outreach campaigns using both traditional and online media, and yes, even the ubiquitous planes carrying banners to ensure that all visitors are aware of the restrictions in place as well as what is expected of them while visiting. And while we are not specifically ordering it, we highly recommend that you wear a face covering, particularly when social distancing is difficult to maintain, such as waiting in line for a slice of boardwalk pizza. As I've said many times throughout this emergency, that I wanted to find a way to allow our beaches to be open for the summer. I applaud Len for raising his hand in partnership for bringing together a broad coalition of Cape May shore towns and for working with us so we could reach this day. I can't say enough good things about the level of cooperation, Len, to you and your colleagues in Cape May and frankly right up the coast in Atlantic Ocean and Monmouth. But you're here today for a reason. It starts with you, and thank you. We are living through unprecedented times, but we have confidence that residents and out-of-state visitors alike can take in a day at the beach safely, so long as the measures we are announcing today, and which are outlined in further detail in the order itself, are followed. And by the way, I should say this, it does not say in my remarks, this is all, Mike, effective Friday, May 22nd. So folks, we're giving the shore communities and counties an 8-day runway to get to take these general guidance points and make them work for their communities. Again, public health determines economic health. Our shore economy is a tremendous driver of local jobs and revenues. Because of the work of millions of New Jerseyans, of you all out there to slow the spread and flatten and lower the curves, we can confidently take this step today. And by the way, data determines dates. Memorial Day weekend is still more than a week away, but the data tells us we can make this announcement now. After months at home, I know many families, probably measured in the hundreds of thousands, if not millions, cannot wait for a day either down the shore or alongside one of our lakes. And I am proud now to be able to give them that day, a day they worked so hard to make possible. Again, I want to thank the freeholder for traveling all the way from Cape May to be with us, and I thank him for his advocacy for our shore communities and his insight, which has been invaluable in crafting a plan that will ensure that families will continue to create their shore memories. We'll hear from Len in a few minutes. So this Memorial Day, New Jerseyans can still have the words that ring in our ears thanks to Messrs. Springsteen and Waits, because down the shore, everything's all right. And even in these challenging times, that is exactly as it should be. By the way, we are aggressively reviewing pool protocols as well as charter fishing, which are not part of this executive order, but we would expect to have some guidance in the next number of days on each of those fronts. And with that, let's turn to the overnight numbers. Yesterday, we received an additional 1,216 positive test results for a current statewide total of 142,704. The daily positivity or spot positivity rates from May 10th, which is when the specimens were last collected, Judy, was 22%. Here's how this is reflected across regions of the state. As you can see, they're converged. The map that we've regularly been turning to keeps showing slower rates of spread across the state. And by the way, Len, not just because you're here, but a big uptick, which is a good thing in Cape May County on this map. In our hospitals, the number of patients currently being treated for COVID-19 has now dropped below 4,000 and stands at 3,958. This is a great milestone to reach, but let's remember this means we still have more than 3,900 of our fellow residents in our hospitals. Our field medical stations again reported 35 patients. This is a breakdown of hospitalizations across region. And here are total hospitalizations for every 100,000 residents, again across regions, to give a more balanced picture. Looking at our long-term care facilities, here are the numbers of positive cases, over 27,000, and fatalities connected to these facilities, 5,168, blessed soul. We continue to throw everything we've got to work to mitigate these numbers. And in our long-term care facilities, by the way, we can today announce that the federal, this is not the National Guard, this is the federal U.S. Veterans Administration is providing 5 10-person healthcare strike teams who will join the staffs at some of our facilities until June 30th. This is a big deal for us. I want to thank Secretary Wilkie and the whole VA team. They're expected to be in state by literally, I think, tomorrow or Saturday. The number of patients reported in either critical or intensive care fell again to 1,157. Ventilator use continues to decline, 898. There were 171 new COVID-19 hospitalizations yesterday, and the number of live discharges was 366. And here are the numbers from yesterday, by the way, broken down by region. Always nice to have bigger numbers on the right than the left, and that was the case, even though just by a hair in all regions, just by a hair in the south. Again, I cannot stress this enough. These trends are your doing. You are the ones who have pushed these numbers and these lines downward through social distancing. And as we begin our long road back, we will need to keep it up to keep seeing these lines move downward. And that will give us even more confidence in the steps to come. Let's look at these numbers in a different light. This is a subset of a chart we've shown you for the past couple of days. Since the peak, all of the metrics we've needed to see in terms of hospitalizations have happened. New hospitalizations are down nearly 2/3 from peak and down by more than 1/3 in just the past couple of weeks. This is a strong number that relates directly to the slowing spread of COVID-19. Overall, hospitalizations are down by roughly half since the peak and more than 1/3 over the past couple of weeks. Patients in our ICUs and on ventilators have both dropped significantly since the peak and over the past couple of weeks. Here's how the overall numbers we report daily compare day to day in every category. There are a lot of green lights. So let's sit on this stand for a second. So the left side of this chart shows you what I just showed you, but the right chart are balls for each day. A red ball is a spike up, a green ball is a reduction. And you can see how the overall numbers we report compare day to day. Here we can see each of these metrics. Let's flip this if you can, by region. Within that all-important 14-day window we've talked about. Again, a lot of green lights. There have been one-day increases here and there, but as I've said before, and as Judy has said many times, we can't get distracted by a one-day number. We have to look at the longer-term trend. It's just like the difference between the weather on a given day and, say, climate change. And the overall climate is now hospitable for us and sufficiently hospitable for us to be taking the steps we've been announcing these past couple of days to begin to restart our economy in summer at the shore. Let's hold on this again for a second. Judy, you've said this from the get-go. You've got new hospitalizations, patients in total in the hospital, ICU patients, patients on ventilators. You see a pretty equal split regionally on new hospitalizations. There's no other way to put that. So in terms of the upward spike days, and that's something we've got to watch. Otherwise, it's largely in the south, and that's exactly as you had predicted, that this was going to go from north central to south. And so you see more red balls on that bottom south line in both patients in the hospital, patients in ICU, patients on ventilators. There's almost an absence, with one day's exception, of spikes in either the northern or central region. We're watching very closely not just the migration, which we had predicted, but that upper left chart where you've got new hospitalizations, to make sure that all the great work, I'll pick a county like Bergen or Essex or Hudson, which had been particularly slammed, and they had driven this so far toward the ground that we're not seeing any flare-ups on the backside. Again, social distancing has worked. It is still working and will continue to work in the weeks to come as we take further steps. And this next slide is one we've been showing the past couple of days, shows the current impact of COVID-19 across our region and in comparison with other states in America. Again, we can make the case that at this moment in time, we are the most impacted state in the nation. And this is why we need to keep up the social distancing even as we begin to restart and recovery. Again, this is shifted. We're doing this. This is as of, I believe, 2 days ago, yesterday. Dan, is this the 13th? As of yesterday. So you've seen we have slipped a little bit in new cases per 100,000. That's a good thing when you slip on this chart. So Connecticut is now just out ahead of us. Patients in the hospital per 100,000, we're still number one in the country. And sadly, new deaths per 100,000, we are still number one in the country. So not only is this chart remind us why we have to keep up our social distancing, but the past couple of charts, I hope gives you some sense of the needle that we have to thread here. Enormous progress on the one hand, and that's unmistakable, with some flare-ups that we got to make sure that we're keeping a very close eye on. And on the other hand, we are as impacted a state still as we sit here today as any American state. And clearly the tragedy within the tragedy are the long-term care facilities. And the notion that this can spread intergenerationally. It could spread from healthy to non-healthy folks with comorbidity. So let's keep at it, everybody. Let's see good things at our construction sites and in our downtown starting on Monday. And let's make Memorial Day weekend not only fun, but safe. You've been extraordinary. Let's keep it up as we take these incremental steps. So this good news aside, in terms of the steps we're taking, there remain countless families who have been dealt the worst news of all, that they have lost a loved one to COVID-19. And today we report that another 244 precious members of our New Jersey family have lost their lives from COVID-19 complications. Our statewide total stands now at a staggering 9,946. In all likelihood, I would like to think otherwise, we will pass another solemn milestone tomorrow. As we do every day, let's remember a few of the incredible lives we've lost. Let's start by remembering a guy I heard a lot about yesterday, Scott Geiger. He was one of our frontline public health heroes, a career EMT. Scott was only 47 when he passed, and he had been an EMT for 30 years, meaning he became an EMT when he was 17. And for the past 17 of those years, he spent them with Atlantic Mobile Health. His brother, Ben, with whom I had the great honor of speaking yesterday, said Scott simply lived to help people in their most desperate moments. And he made a point of saying Scott never called what he did a job. He always referred to his EMT activities as his duty. Scott's second love was the New York Jets, even if they did not always love him back. But he knew perseverance, and you have to be that way if you're a Jets fan. After all, Scott defeated cancer 7 years ago. He was a great friend to many, the first to step forward to help or to get a colleague a cup of coffee or breakfast when they were busy, but he loved his family the most of all. To Scott's mother, Joyce, and she's had her challenges, his father, Sandy, his brother, Ben, with whom I spoke, his loving aunts, uncles, cousins, nieces, and nephew, his goddaughter, Lauren, we send you all our deepest condolences, and you are in our thoughts and prayers today. And Scott, my buddy, we thank you for your service to the people of New Jersey and for always doing your duty. Next up, this is Judith and Ferrara Coppola. Judy was born in Newark and lived in Union. You won't be surprised when I say this, given that photo. In her youth, Judy was a model, but her real passion was her family. They recall that Judy was at her happiest when everyone was gathered around the table. But outside, she took equal pleasure in spending time on the beach at Spring Lake with her children or going on a road trip with her sister, Terry. I had a long conversation with her sister, Terry, her big sister, Terry, by the way, who essentially had acted not just as her big sister, but as her second mom. Among other things, they were both hairdressers, and I've never met Terry face to face, but I can tell you based on my conversation, she would fit comfortably into the category of a pistol. She was something, and so was her sister, Judy. Judy enjoyed a game of bingo and also enjoyed watching, in this case, her New York Giants play football. I'll incorporate the prior comments by reference. She was 69 years old. Judy leaves behind her 2 sons, Michael Jr. and Vincent, along with their wives and 2 grandchildren. She also leaves her beloved sister, Terry, as I mentioned, her second mom, and her family, including her nieces and nephews. We keep them all in our prayers and thoughts today. God bless you, Judy. And finally, we remember Marie Spokeo. She was born and raised in Newark. She lived for many years in West Orange and moved to Toms River 23 years ago. Her family remembers her as, quote, the traditional Italian mother who loved her family and ruled with a wooden spoon. And does that picture say that in spades, huh? God bless her. She loved to bake and to ensure that her family always sat down to a good meal, especially at Christmas. Marie devoted herself to St. Gerard, the patron saint of mothers, and was a member of the St. Gerard Ladies Guild. She also was a breast cancer survivor, bless her, and now she is reunited with her beloved late husband, Michael. She leaves her daughters, Susan and Michelle, and I will tell you, having spoken with both of them yesterday, they remain, and who could blame them, devastated by their mom's loss. She also leaves behind Michelle's husband, Frederick, and their 2 kids, Marie's grandchildren, Brittany and Nicholas. She also leaves a sister, Anne, many nieces and nephews, and she also leaves behind her furry friends, especially her best friend, Zoe Rose. May God bless you, Marie. May God bless your family at this extraordinarily difficult time. 3 more members of our New Jersey family who COVID-19 has taken. Let's never forget them. And by the way, unrelated to COVID-19, and I have to say that explicitly, but we lost a giant overnight. Jerry O'Connor, former Saddlebrook mayor, freeholder, director in Bergen County, state senator, a giant. We lost Jerry overnight. I spoke with his wife, Terry, who herself is a giant, and their son, Kevin, who is a very dear friend of mine. So I want to give a shout out to the O'Connor family and to say that Jerry and his memory are in our prayers. Switching gears, I'm going to leave the report from the Department of Labor and Workforce Development to the Commissioner, but I do want to give Rob and his entire team a huge shout out. As Rob will report, the department is clearing 140,000 residents' claims off the backlog this week. And I know they're going to keep at it until they deliver for every eligible resident. If you're frustrated out there, Rob doesn't blame you, I don't blame you. But know that an enormous amount of progress has been and continues to be made, and that you will get every single penny that's coming to you, including the federal piece. So Rob, thank you to you and your team. I also want to note, and I want to give Pat a shout out here, that the Office of Emergency Management has passed another milestone in their efforts to ensure that our frontline healthcare workers and first responders have the personal protective equipment, or PPE, that they need to do their jobs. The Office of Emergency Management, affectionately called OEM, has now passed out more than 42.6 million pieces of PPE that has been distributed. 2.5 months ago, that was not a line of business in either the OEM or the state of New Jersey. We're now well over 42 million pieces out. So Pat, to you and the team back at the Rock and in the warehouse, congratulations and job well done. Now, with the news that there will be summer at the Jersey Shore and at our lakes, let's close on an equally inspirational and upbeat note. Let's start in North Arlington with George Zachary. That's a t-shirt George has got on, huh? George lost his father, Adele, on 9/11, and his sister is a healthcare worker. He's been running the Breakfast for Our Heroes campaign to provide breakfast for healthcare workers across the state. He's already hit 24 hospitals and is now focused on serving those at Clara Mass Medical Center in Belleville and St. Barnabas Medical Center in Livingston. And just as importantly, he's been leaning on local coffee shops to provide the goods. So he's supporting our small businesses in the process. So to you, George, keep it up. One breakfast sandwich and cup of coffee at a time. I know our frontline heroes thank you, and we do too. And lastly, this is a big one. How is this for an inspiration? Let's bring up Allendale's Sylvia Goldschall. Sylvia is 108 years old. She was 7 years old during the 1918 flu pandemic, and she survived it. Last month, Sylvia tested positive for COVID-19, and now we can say she has beaten that. A tremendous life, a tremendous spirit, a tremendous show of strength, a tremendous role model for all of the rest of us. So to you, Sylvia, we send you all of our best for the many, many more years to come. How about perhaps another 108? And I think that's as good a place as any for us to end my remarks today. With that, I'd like to introduce again a friend, the Vice Director of the Cape May County Board of Chosen Freeholders, the Mayor of the precious Sea Isle City. Please help me welcome Len Desiderio. Len, thank you for being here.
Governor, thank you, and it is my honor to be here, and happy birthday to Sylvia, 108 years old, and I too wish her another 108 plus years. Governor, I have to start off and just thank you for your strong leadership during this entire time. Your staff and you have been absolutely fabulous. And as I've said many times, this is not a Republican or a Democratic problem. This is a problem that we all need to work together with. We all need to come together, and under your leadership, Governor, we are moving forward, and I do see light at the end of the tunnel. It is fabulous news about the beaches. I can't tell you how happy we are in Cape May County, and I'm sure across the 127 miles of beaches in New Jersey, to be able to open up our beaches. I know that in Cape May, and in particular in Sea Isle, they are now waving to me with 5 fingers. So I'm very, I'm happy for that, and it's great. What we are planning to do, and this is with Ocean City, Strathmere, and Sea Isle, is to have a dry run this Saturday for capacity management, in which we can learn and go to school. This is something we've never had to do before. Our job has always been to bring as many people as we can to the beach, as many people as we can to our communities. Now we are practicing capacity management. We're going to have a Memorial Day. It's going to be a little different. We're excited about the beaches being open, but the 3 communities, and I know other communities in Cape May will be joining us, but the 3 communities are going to be practicing this Saturday. We're going to be observing it, and we're going to learn how to go to school. As you know, the Cape May County Board of Chosen Freeholders put together a task force, and it was headed by Freeholder Will Morey and myself, along with business leaders from throughout Cape May County, from all walks of life. And we worked many hours to come up with a plan which promoted safety first, but was allowing us to get our businesses, we feel, open. We presented it to you and your staff, and once again, Governor, I have to tell you, going back and forth with your staff has been a fabulous thing for us, because when we report it to our community, when we report it back to our council, when we report it to fellow freeholders and our citizens, they really do appreciate that the line of communication between us and the governor is the way we're having it, and it's the way it should be, and I do appreciate that. And as you know, we've presented this plan to you and your staff. We've had a number of conversations with your staff, your chief of staff, Michael. Alex has been wonderful dealing with the mayors, and et cetera. You getting on the phone on Tuesday was wonderful with 24 Shoretown mayors. And as I said before, this is not a Democrat or Republican problem. We have all worked together. And by opening up small businesses for curbside shopping, which will start on Monday at 6 o'clock, it has relieved such a burden from these mom and pop shops, these small businesses. When this first started, we have to remember, they were bringing in their stock for the spring. It was March. They were bringing in their spring attire. They were getting ready to open, especially at the shore communities. Some of them never even got to be open when we had to close down. And they have been closed down for 59, 60 days. This is a shot in an arm to them. This is something we thank you for. This is something we're going to follow. And what I've said to the freeholders, to Cape May County, and to my community of Sea Isle City is that we all need to work together. We walk together, we move together. This is something new. When we have a storm coming, and as bad as a storm is, we generally know how to prepare. We know what to do. We know when we have to evacuate. With this, and after the storm, we know that there's repairs. We know there's beach replenishment. We know that shop owners, homeowners have to make repairs to their property. With this, We didn't know what was coming, how it was coming. The governor's daily briefings that he has done, along with these wonderful people up here, has been an inspiration, and it has given the elected official and the citizens of Cape May County something to hope for. And that's what we have, hope. We have great hope. We've been following the governor's orders to the T. We will continue to follow the governor's orders, and we're moving forward. And great news for the shore with the beaches open, great news for the shore with the small businesses able to do curbside business, and we will continue to move forward, and we will watch capacity management, and we will move forward together. And I have great hope for us, and I have great hope for us this summer. And thank you, Governor, once again for your leadership. We will be working together. I have your cell phone number, so watch out. I'll be calling you many, many times. And thank you for compiling such a great staff that takes care of not only the freeholders, the mayors, but all of the citizens of Cape May County. God bless you all, and thank you.
Len, that was incredibly powerful, and cannot thank you enough for your leadership and your partnership. You're such a good guy. In fact, you even just promoted Delamater. But seriously, you've been incredible to work with. We knew that before this, by the way. You and I have known each other before this crisis, but we've really got to know each other during this. And so to you and your team and your fellow freeholders and the mayors in the communities, cannot thank you enough. And again, you put together a really good model, and in many respects, what we've announced today through this executive order is an homage to the model that you put together in Cape May County. So thank you, Len, for this and for all. I know our team thanks you. Now, I don't know why I feel this way today, but I introduce the woman to my right every day, both at the beginning for her remarks and at the end. And almost inevitably, it's Tina Tana's with her, or Ed Lifshitz, and I want to give Christina Tana shout out as well. But Dave, you asked me, I thought about this yesterday, you asked me how was this going for me? And I chose to run for office, and I chose this position as an elective matter. And when you do that, you go, with that goes not just the thick skin that I referred to yesterday, but you go into that with your eyes open. And so I'm going to be just fine, win, lose, or draw. I know that for sure. But you have no idea, folks, what it is like walking in the shoes of Judy Persicelli. Now, do we always bat 1,000? God knows we're going through this for the first time. Who could bat 1,000? But no one has done more over the past 3 months in this state, and I would argue in this country, as a health matter, as a leadership matter. She has been absolutely extraordinary, with literally the weight of the lives of 9 million people on her shoulders, morning, noon, and night. We could not ask for better leadership, and I'm incredibly humbled to sit here every day alongside of her and to go to battle with her every single day, morning, noon, and night. Please help me welcome the Commissioner of the Department of Health, Judy Persicelli.
Well, thank you, Governor, for that very kind introduction. As the Governor announced, we've requested additional support from the Veterans Administration for 5 of our long-term care facilities. These teams will include clinical staff, nurses, and certified nursing assistants to provide additional staffing, implement infection control recommendations, and help residents with activities of daily living. These individuals are in addition to the over 100 VA personnel supporting our vulnerable residents at the Menlo Park Memorial Veterans Home and the Paramus Veterans Memorial Home. The state now has over 300 National Guard members throughout the entire state, from Sussex to Cape May, working in long-term care facilities and in our hospitals. We are grateful to the VA and the National Guard services. Any additional support, be it direct care or direct caring and comforting, is appreciated. As I covered yesterday, we are getting increasing reports of pediatric, multi-system inflammatory syndrome from our healthcare providers. The department is investigating 17 possible reports of this condition. Yesterday, I shared that there were 18 possible. One report did not fit the definition. These are among children ages 2 to 18. They're in 9 counties: Bergen, Essex, Gloucester, Hudson, Middlesex, Monmouth, Passaic, Union, and Warren. This is a rare condition, but it can be treated. Early recognition is important, so we ask that parents look out for the symptoms. Your child may seem irritable or sluggish. Your child may have abdominal pain without another explanation, or episodes of diarrhea or vomiting. Your child may have a rash, conjunctivitis, enlarged lymph nodes, or red, cracked lips, or a red tongue, and perhaps swollen hands and feet. Please call your healthcare provider if your child has any of these symptoms so that your baby can be evaluated and treated. We are concerned about the incidence. We will look at every single report, but at this time, we have not established a clear link to COVID-19. The Department of Health put out a public health update on May 7th to all clinicians to alert them to be aware of pediatric multisystem inflammatory syndrome potentially associated with COVID-19. The alert noted that we are working closely with the CDC and our neighboring states to investigate reported cases of multisystem inflammatory syndrome that may possibly be associated with COVID-19. Cases characterized by persistent fever and features of Kawasaki disease and/or toxic shock syndrome were reported in the United Kingdom and have recently been identified in children in the United States. The governor reviewed the new cases and deaths. In terms of deaths, the breakdown of deaths by race and ethnicity is as follows: white, 53.5, black, 18.6, Hispanic, 19.1, Asian, 5.4, and other, 3.4. There are 525 long-term care facilities in the state reporting COVID-19 cases for over 27,000 cases. At the state's veteran homes, similar to yesterday, with a census of 662, 366 residents have tested positive, with a total of 137 deaths of our residents. At our psychiatric hospitals, with a census of 1,240, we are reporting an additional death at Ancora for a total of 13 patient deaths at the psychiatric hospitals. The daily percent positivity for the day, May 10th, was in New Jersey overall 22%, North is 20%, Central 23%, and South 25%. That concludes the daily statistical report. As we take incremental steps toward reopening, I want to remind everyone to continue to take steps to protect your health. Stay home when you're sick, clean and disinfect frequently touched surfaces, cover your mouth and nose with a cloth face cover when around others, cover your coughs and sneezes, and wash your hands frequently for at least 20 seconds. It is important that we stay vigilant to continue to reduce the spread of this virus in our state. Stay connected, stay safe, and stay healthy. Thank you.
Judy, thank you, and thank you for that. We haven't said it in a couple of days, but the racial inequities are something that you and I and our teams, and Lieutenant Governor Sheila Oliver, who we want to give a big shout out, who's in Atlantic City, by the way, today, is something we continue to look very carefully at. And I meant every word and then some. So thank you very much to you and Tina. And again, on this Kawasaki piece, you made the point, Tina, on the call earlier, this is treatable. So you identify the symptoms early and get to your healthcare practitioner, and this is something people can recover from and get through, so with the proper treatment. Thank you. Again, another guy who's not sleeping much, to him and his team, who are doing an extraordinary job in the face of a tsunami unlike any we've ever seen before. And again, that's not meant in any way to make you feel better if you're not getting through yet. We understand that, but it's Thursday. This is the day that both the U.S. and each of the states announced the new unemployment claims, and we thought it was a good time to ask the Commissioner to join us. Please help me welcome the Commissioner of the Department of Labor and Workforce Development, Rob Acero-Angelo. Rob?
Thank you, Governor. As I said last week, it is a harsh reality that Thank you, Governor. As I said last week, it is a harsh reality that COVID-19 swelled the nation's unemployment rolls to unprecedented numbers in a few short weeks, as shown by more data released today. As business as we knew it ground to an abrupt halt here and everywhere else. But every single day, thousands and often tens of thousands of new claimants begin receiving benefits due to the hard work and dedication of the Department of Labor and Workforce Development staff. I want to lead with a sincere thank you to our claimants for their patience and understanding as we work toward getting 100% of our eligible workers the benefits they are due. With such big numbers, it may not seem like it at first glance, but New Jersey's unemployment insurance system is working as intended, with nearly 800,000 unemployed and underemployed workers receiving state and federal benefits. That's more people than live in 5 U.S. states. More than $2.7 billion has been deposited into the bank accounts and onto the debit cards of eligible New Jersey workers. According to a Tuesday New York Times article, in 2019, New Jersey led the nation in percentage of eligible unemployed workers receiving benefits. The same was true in 2007. And many of those same folks who set this standard are working right now, as I speak, to process even more claims for our state. The mission of this department has never wavered, to lead the nation in delivering on our promise to ensure our workers receive every benefit they are entitled to, unemployment and others. Right now, according to that same Times article, our state is still performing better than most to pay out benefits after this crush of layoffs and temporary furloughs due to COVID-19. But as I've said, this means little to those still waiting for their benefits, and we want to do more. Since unemployment insurance is a federal program, the U.S. Department of Labor, my former employer during the Obama administration, has just reaffirmed strict guidance to states, noting that many of the outside-the-box solutions we have been exploring, such as temporarily suspending or amending the troublesome weekly certification process, cannot be enacted without putting our entire unemployment system, including billions in CARES Act funding, at risk. This isn't some dusty law we pulled off his bookshelf. This memo you see up there came earlier this week. But here's what we can and have done this week alone. Today, through upgrades and improvements in processing, I'm proud to announce that an additional 139,000 claimants are being made newly eligible, which is hopefully of some comfort to many of those who have been waiting for benefits. To be clear, this is in addition to the tens of thousands who regularly become eligible each week in normal course. It includes nearly 60,000 claims in the third batch of the pandemic unemployment assistance claimants that were just converted for processing, meaning essentially everyone who is eligible for this new federal assistance and applied by April 12th, which is an overwhelming majority of them, has been processed. This is incredible work, which I will detail more later, but we want to thank all of our staff who have been embarking on creative solutions to the historical volume of claims that came with this pandemic. We also appreciate all of the ideas coming from the public and our lawmakers to increase our staffing capacity. We have been working on this, as I mentioned last week. It's important to note that an unemployment claims agent cannot simply be plucked off the street and sat in front of a computer screen. Handling sensitive personal information such as social security numbers, birth dates, and bank account information requires trust and a state police background check. Thanks, Pat. It means knowing the ins and outs of unemployment law. It means making benefits decisions based on nuanced state and federal regulations, and it takes experience with our systems, especially at this time. However, in addition to hiring and beefing up our call centers, the Labor Department is making the most of the talent at our fingertips, and I couldn't be more proud of our employees for stepping up to the challenge of COVID-19. For those of you who are unfamiliar with unemployment, I'd like to take a moment to explain how the process works. Wage earners and their employers pay premiums into the Unemployment Trust Fund. And when they are separated from an employer through no fault of their own and otherwise eligible, they receive the insurance payments they deserve. But now there are hundreds of thousands of workers who have never been part of that system at our door for their PUA benefits. We will be reimbursed from the federal government for the benefits paid out, but the amount of time and effort that has gone into serving this new group of workers has impacted all of our customers. This additional universe of workers includes independent contractors, self-employed workers, and workers who don't have enough income history to qualify for regular unemployment. While we're thrilled these workers who have been negatively affected by COVID-19 are getting government support through pandemic unemployment assistance, it's presented an entirely new set of challenges as systems that have been in place for a certain type of worker are now serving as a catch-all. These 200 to 300,000 people need to have their claims reviewed because there's incomplete income information for these applicants, and their wages must be verified by labor staff per federal law. There is no way around this. Imagine if every VA hospital was told that tomorrow, in addition to veterans, they must immediately start accepting any patient who's ever in the Boy Scouts, Girl Scouts, or wore any kind of uniform. Eventually, they'd be able to assist this population. But in the short term, it's obvious to see the challenges and delays it would pose to its typical traditional patients. But we are absolutely making progress. As I mentioned earlier in my remarks, this week another 139,000 will become eligible for benefits. And besides the PUA, it includes 82,000 claims that may have been pending for weeks due to non-monetary appointments, Social Security number errors, and other identity-related issues, and those that were stuck due to lingering certification response errors. We'll make these claims payable now, so claimants can receive benefits while waiting for adjudication. This is a big step, and it's one more piece to our puzzle that is falling into place. While there are small percentages of people who have been waiting for some time, it's not because of a system glitch or delay by the agency. It's because for some reason, under unemployment law and US DOL guidance, they are not immediately eligible for benefits. If not for system upgrades made during the Murphy administration and programming improvements since pandemic hit, the number of claimants receiving benefits would barely be over half of what it is today. But now that there is such an incredible number of people in the system certifying benefits, we ask all of our claimants to follow our Social Security number-based schedules so we can regulate the load coming into our systems. And take a moment, or two, or three, to read the important guides we posted to make sure they are answering questions correctly. We know many, many thousands are still getting tripped up on the required questions, as shown before in that earlier USDOL memo. This past week alone, over 40,000 claimants locked themselves out of the system for their weekly benefit, and that is adding to the volume our agents need to handle. These inquiries are preventing those who truly need to speak to an agent from getting through. That is why we put out the step-by-step guides, and why we launched Dolly, the Google chatbot, last week, which has already seen 110,000 engagements. We want to help everyone, especially as we're preparing to make approximately 139,000 additional self-employed workers, independent contractors, and others awaiting benefits newly eligible this week. These folks will be receiving email instructions on how to claim their weekly benefits starting this Sunday. I am proud of this progress, and while we wish we could wave a wand, hire unlimited staff who have already had years of UI experience, and have everyone paid today, the process is not that simple. We must protect claimants' personal information, prevent fraud, and more importantly, obey U.S. Department of Labor rules, all while paying benefits in the timeliest manner possible. Until then, I'd like to remind all of you to visit our website at myunemployment.nj.gov, and please know we are singularly committed to our claimants and getting them every penny they are eligible for as quickly as we can. Thank you, Governor.
Rob, thank you, and thank your extraordinary team, and I know this is unlike anything any of us have ever dealt with before. So to folks out there, please keep the faith. Again, to repeat something we've said every day, you will get every single penny that you rightfully deserve, including the federal monies. And Rob, again, I can't thank you enough for your leadership and your team's extraordinary efforts. Thank you. With that, we have a guy we hear from each day, Colonel Pat Callahan, with any updates on compliance, PPE, infrastructure, protocols. Anything you got, Pat? God bless you.
Thanks, Governor. Good afternoon. Probably one of the more, if I can use the Q word in law enforcement, one of the more quiet nights for compliance. Newark Police Department issued 275 warnings, which I think is a good thing, and one other incident in Elizabeth where a subject was cited for hosting a large gathering. And Governor, since you mentioned the benchmark that we've hit with regard to PPE, it's a good time to also thank, and he happens to be here today, Commissioner Asaro Angelos has in Department of Labor public safety staff who are responsible for inspecting all of that PPE before it goes out, so we make sure that we're not sending bogus or not good equipment out to our first responders and healthcare workers. So just a huge thank you to you, Rob, and to your staff there. And just lastly, just to somewhat tag team on your remarks about the Commissioner of Health, I just did the math. I have been with her or on the phone with her for the past 83 days straight. I think it's within my authority to designate her as an honorary trooper. The synonym for trooper is fighter, warrior, soldier. She fits the bill on all of those things and then some, and I'm honored and humbled to serve with her every day. So thank you, Trooper Judy, for doing what you do. Governor?
That's far more impactful than anything I could say, that's for sure. Pat, thank you again to the OEM team, to your inspection team, Rob, and certainly to Judy and Tina and the Department of Health. And again, Len's here today because we've said all along it takes a village. I had a good meeting with the Senate President and the Speaker last night. We spoke about a number of things, including we all felt a good meeting was had yesterday at the working group level on bonding and our ability to take advantage of the bonding opportunities. But we don't get here, any of us, by ourselves. And your point in terms of just the day in and day out nature of something like this is extremely well taken. You know, one of the things that came up on the call that Len and I and Mike Delamater organized the other day, and Pat, I know you'll be all over this with your colleagues, as well as local and county officials. We'll have inevitably a lot of people who want to let some steam off. Who could blame them, having been staying inside for so long? And so, Len, I love the fact you're gonna take it around the track in a few communities this weekend, and I'm sure, Pat, both in the parks as an ongoing matter with the park police, your own county and local law enforcement, as well as at the shore and our lakes, will be out there. God willing, folks will continue to do just as they've done, overwhelming compliance and doing the right thing. So hats off to each and every one of you. We'll start with John, but before we do, we're going to go down and then come back to Dave and go down. So we're going to do lanes today. There are a lot of you, so I'm asking you, John, please set the example. Please keep these brief and short. We will be here. Where's Danny? I lost Dan. We'll be here tomorrow at 1. I don't think there's a VTC. And we'll be here Saturday at 1. And Sunday will be electronic unless we think there's a reason to be with you either on the telephone or face-to-face, in which case we'll do just that. I mentioned this earlier. We hope to have, and Matt Plackett is now with us, we hope to have guidance on elections in the next day or two. We hope to have guidance, I think, on elective surgeries. We're still baking, which is more complicated, I think, than any of us thought. We are still, I mentioned earlier today, we're going to have some pool and charter fishing guidance as well. I hope all of that within the next couple of days or so. So please bear with us. If you've got questions about that, just give us another day or two and we'll get back to you. On charter fishing and pools, needless to say, we're trying to get stuff in place so we can be in as full a shape as possible when next Friday the 22nd comes around and we kick off Memorial Day weekend. With that, Matt, John, you're up. Good afternoon.
Thank you, Governor. On the shore reopening, can you tell us what specifics you were telling the towns and how to formulate their plans? Will we be able to see what the plans are for each town? And enforcement on social distancing, can you explain how shore towns are going to handle keeping crowds away? I mean, what do you expect, like the Wildwood Crest Beach Patrol to be going up and down? I mean, how's that going to look? There was a nurse's aide at the Menlo Park facility who died. She's the second of the frontline staff there who died. Her family and union are there saying that there was a lack of PPE early on. Can you speak to that, as well as claims by the unions and others that the state prioritized hospital PPE over veterans and nursing homes?
One more, please.
Sure. And on the labor, on the unemployment website, all of the stuff that you're talking about, except for the number of claims, was in place a year ago, 20 years ago in some cases. You guys knew that there were choke points with the labor system. Your transition report said that. It's an archaic looking form, and people are going nuts who aren't getting their claims, being told you didn't fill out the form properly, we'll get around to it. How can you speak to this? And also, what are you going to do to fix this thing?
So I think on your first question, Len, you may want to weigh in here. In fact, I'd love you to weigh in. We are, as I think you're hearing today, giving guidance at sort of not a 10,000-foot level on beaches, but we're sort of setting the parameters, and we're asking, which has been the partnership all along, the local mayors and county officials to actually execute on that. And I think it's going to, part of the reason is not only do they, they've forgotten more about shore realities than any of the rest of us, number one, but number two, it depends on what beach you're in. Wildwood is a whole lot different than Belmar, to pick two beaches that I've been at recently myself. Len, any comments, particularly on social distancing?
Yes, Governor. Our police chief, Tom McQuillan, along with our beach patrol captain, Rennie Steele, have been working on a plan. And we do not want the lifeguards supervising and watching for social distance. We want them to keep looking straight out at the ocean and do what they're supposed to do, watching to make sure everyone is safe. We're going to have some goodwill ambassadors up there that are going to be passing out materials, just giving people notification on what you can do, and please to practice social distancing. If you must stay together and you're a large family, we're going to ask you to please put on some face shields. We're going to ask you to please respect everyone. As I said earlier, this is all brand new to us. We're going to be working together. I know our police chief is going to have a couple of police officers on quads riding up and down, making sure, just giving information out and making sure everyone is adhering to what we want them to do. But the lifeguards, we want them to do the job that they always do, and that's to watch the ocean and watch to make sure everyone's safe there. We'll watch what's going on, and that's one of the reasons why this weekend Ocean City and Strathmere and Seal has decided to do a dry run, because it's better to do it this week than we figure Memorial Day weekend, the traditional kickoff to the summer season. And we'll be able to come back and have a plan in place for next Friday. And that's the way we're going to work that. Thank you, Governor.
And my pleasure, Len. And I know each of the communities will communicate and the counties will communicate any parameters that they've got. I read of this tragic loss of life, John, as well. Remember, we started as a nation literally almost, I would say, with a pea shooter in terms of PPE in the stockpile, in terms of testing materials, testing kits and swabs, et cetera. And we have cobbled this together from nothing to 42.6 million pieces distributed of PPE and testing that'll now be able to test within the next couple of weeks 20,000 or more tests a day. That doesn't compensate for any loss of life. And so bless the nurses' aid. I don't have any insight on the particulars of the case, Judy. Do you? We don't, so we can come back to you. I don't, again, bless the loss of life. Pat, I mentioned, I think 2 weeks ago, that in particular the White House is sending in a whole other wave directly for long-term care. I will, Rob, turn to you. You hear this, hey, you've got 19-year-old systems and all the anxiety that goes with that. Any comments you've got to John?
Real quick, thanks, Gov. I want to be careful. I don't want to conflate the certification question issue with the age of our websites or how it looks, because the certification questions are just questions that are on a standard form. And no one has problems filling out forms, or there's no form errors that are causing any delays. That being said, yes, the system is old. Some of our neighbor states have spent hundreds of millions of dollars to fix their system to no avail, quite frankly. And while and by the way, just so you know, we're on these conference calls. I've been going to these conferences in this job, my last job, about UI systems. And quite frankly, some state might have a prettier looking website than another, but the behind the scenes architecture, the behind the scenes system are quite frankly all the same. The fact that we need to interconnect with multiple systems across multiple states is part of the issue. If we talk very often about the jobs.covid19.nj.gov portal that got up and running within a week or two of this starting. That was easy to set up. It was our own data, our own information that we sort of house and control. We don't have that same luxury with the unemployment system, because we're made by the federal government to store data going back to literally the 80s, 90s. Everybody's basically wage history for their entire work life. So it's not like we can start up a new system on our own. These things are interconnected with systems all over the country, quite frankly. Our ICON system, which verifies information from other states, verifies identity. So it's not like we can, I'm not saying that we can't make improvements, and I think we've made a lot of customer-facing improvements since we've been here, quite frankly. But I think that in the back of the house architecture, that's got to be a federal solution in the end. And I'm hoping that one benefit that comes out of this is that, you know, we've never heard anybody in Congress or anywhere else talk about unemployment data systems, computer systems. Hopefully this attention to this will give us a federal response, because
That would be one in a row if that were to happen.
right, because frankly, every single state is implementing the same federal system. The fact that we're all on 50-plus different operating systems, different ways to apply, is totally nonsensical. So I'm hoping that in COVID 7.0, whenever it's going to be in Congress, that one of them is going to be a unilateral unemployment system that every state can plug into, put their own parameters in, still have a home rule or state rule about who gets benefits and who doesn't. But the fact that we're all running different systems is ridiculous.
Thank you for that. Matt, you wanted to add something on beaches, I think, right?
Yeah, just on the beaches order, and John, when it comes out and you see it, I think it'll be a little clearer, but there's a number of requirements set forth in the order that are fairly specific, and then there are some that are broader parameters, such as the requirements around social distancing. They have to maintain 6 feet of distance. How they do it, some of that is up to the local jurisdiction, because beaches vary up and down the state, as we know. That said, there's also a requirement in the order that each jurisdiction conduct a communications plan to communicate the restrictions to the public, and so that they understand what they can and can't do and how access will work.
Including before they get to the beach, importantly. That's the reason for that.
Correct, and we'll be doing that at the state level as well.
Thank you. Sir.
Yes, following up on the unemployment system, I have 2 questions, one for you, Governor, and one for your Commissioner. And the question for you is, in your travels, you mentioned going to the beach recently. How often are people coming up to you about the unemployment system? And do you have anyone in your circle, your family or friends, struggling with the system as so many others are? And then for your Commissioner, I'd like to talk about the bones of the system. When people get a check 1 week, but then they go 3 more weeks without one, is that something in the way they're filling out the form, or is there something in the bones? Is the glitch in the system?
People come up to me all the time. And if you follow a press conference, which we do every day, I think, John, one of your colleagues said, now I'll have to start answering the tough questions. This is the 58th press conference we've done, by my count. So you may want to tell Charlie that we're answering the tough questions every single damn day. People are rightfully coming out of the woodwork. If you've lost your job, in particularly the unprecedented numbers, and you are, if you add to that the frustration that you can't get through, and you already, the average American has, we've already seen the studies, in New Jersey's no difference. People are living at the edge of their affordability. Usually defined as one bad healthcare event away from bankruptcy. Who could blame them for being frustrated? So I've gotten calls at home. I get texts. I get calls on my own phone. People in every Ask the Governor, every interview, every press conference. We get it. And by the way, we're no exception to the country right now. This is at levels that are just beyond anything we've ever seen before. Folks are upset, they're nervous, they're scared, and who could blame them? Rob, real quick on the second one.
Yeah, real quick. Also, obviously, tons of friends and family coming to me about these issues as well. But based on your one question, it's always hard to answer generic questions because every claim is different. But an overwhelming majority of folks who start getting paid and then don't receive benefits next week is because they've answered a question. And I don't even want to say incorrectly. They answered the question how they answered it. But those are the USDOL guidelines. If someone answers one of these questions in a certain way, they are no longer eligible for UI benefits, which is why we've gone to great lengths for me being here, putting out press releases, putting out, basically, they need to attest that they've read the information about each question before they go through and certify. So yes, if someone's got benefits already and they don't get them the next week, there is no glitch in the system. That means that one of the questions was answered adversely.
Thank you. Channeling Sonny and Cher, we have Paul Mulshine. Paul, how are you?
The Republican senators are calling for an inquiry into the long-term care problem, and I gather more than 53% of the deaths are there, and they're complaining, and also a lot of my readers are complaining, that the administration was doing things like cracking down on golfers and joggers while sending COVID-19 positive patients into nursing homes. And I gather there still isn't full screening of the staffs in the nursing homes. So do you think there should be an inquiry into that? Because that's where most of the deaths are.
Anything else, sir?
That's it.
Yeah, I don't think how we're dealing with, this is not an and/or. You can either deal with golfers who are non-compliant or deal with the long-term care tragedy. Those are, we can do both. Listen, Paul, it's an overwhelming tragedy, and it's not unique to our state. We have, Judy hired a national renowned firm a couple of weeks ago. They are right now digging through this whole, they're not only plussing up staffing, they're in there for a reason, to give us exactly what's gone wrong, what can we do better, how does this industry need to look in the future. Again, the uneven performance of this industry is jaw-dropping, and that's as charitable as I can get. I've said all along, we welcome, we can't get there by ourselves. We welcome the legislative reality in this state, and I think we've worked extremely well with the legislature and communicated at a high level on both sides of the aisle. But you add National Guard, VAs, the firm we've hired nationally, the directives that Judy's been putting out since March 6th, testing now required by May 26th by mandate of universal of patients and staff, all staff. I don't, the numbers don't lie. It is an overwhelming tragedy. There's just no other way to put that. And I speak every day to families who have lost loved ones.
I would urge local governments to be diligent about the business compliance and about individual compliance. And then if you see a change in those numbers, react immediately. React immediately. If you allow this virus to get ahead of us, we will have a problem. So we'll have the data, react immediately. At the same time, the states need help from the federal government, and that's a topic that's being discussed now. Washington must act. It must be smart. It must be fast. New York State is a $61 billion hole. When you shut down the economy, you obviously create an economic hole for the state. Well, what does the state fund? The state funds local governments, funds schools, funds healthcare. If the state has no budget, then schools get cut, hospitals get cut, local governments get cut. If local governments get cut, then you cut police and firefighters. Why would you ever want to cut essential frontline personnel at this time? Makes no sense. Washington has already acted. They've done a lot of business incentives. Great. But we need our healthcare institutions, we need our schools, we need our police and firefighters funded. I spoke with President Trump this morning. We spoke again about the state funding issues. He heard me out. I've also asked him to expedite certain payments, and he's expediting a $3.9 billion payment to the MTA, which is a very large transportation agency in the state, which desperately needs funding because the ridership is way down. And the president cut red tape and actually sent the first installment today. So I'm grateful for that, and I thank him. The House, meantime, has proposed a bill. The bill does a lot of good. It funds state and local aid, $500 billion, to make up for those shortfalls. It funds testing. Everybody talks about testing, tracing. Those operations have to be put in place, and New York State will wind up hiring thousands of tracers. We need funding to do that. I understand it's our obligation. States are in charge, governors are in charge, but we need help with funding. And the House bill repeals the SALT tax change that was made in Washington about 3 years ago. And that tax change that they made cost New York State billions. The House bill repeals that change, which is a significant benefit to this state. And ironically, the states that were most hurt by SALT are the states that have the most pain from the COVID virus. So repealing SALT actually is, in my opinion, the best thing you can do to help the states that are now battling the COVID virus. In New York State, the SALT repeal increased our taxes $12 to $15 billion, just New York State. We now pay $12 to $15 billion more every year to the federal government, believe it or not. So that would be a major boost. But Washington has to act, no delay, no special interests getting priority or special treatment here. And when we're doing these corporate bailouts, make sure we don't make the mistake we made in 2008, where we gave corporations large bailouts and the corporations took the money and paid themselves with the money. I was Attorney General at the time. I brought cases against corporations that took the bailout and gave themselves all a pay raise. Why should the American taxpayers now bail out corporations unless they're going to rehire workers? I'm afraid you're going to see corporations that will not hire back the same number of employees. They're going to use this pandemic as a way to restructure or get lean. If a corporation is going to take government money, they should rehire the same number of workers they had before. I did an op-ed in the Washington Post to that effect. But I believe that should be a condition across the board. Any corporation that gets money from the government, from the people, should hire back the same number of workers. If you want to lay off workers, don't expect the taxpayer to subsidize you laying off workers. And if there's a moment in our modern history where we can get out of this partisan gridlock, hyper-political moment, now is the time. My position of funding for state governments is not a Democratic position. There's an organization called the National Governors Association. It's Democratic governors, it's Republican governors. The chairman is a Republican governor. I'm the vice chairman. And the NGA, National Governors Association, in a bipartisan way is urging Washington to pass the relief for state and local government. So there's no red or blue here, right? It's red, white, and blue. Also at the same time, we went through all this pain. People talk about reopening. I want to set the bar higher. It's not about just going back to where we were. Let's use this as a moment to grow and to get better. Let's learn from the pain that we went through. And I talk about reimagining New York, and let's use this as a moment to reimagine our education system, our telecommuting, our telemedicine, a better public transportation system, a better public health system, and take this experience and grow from it, right? Life will knock you on your rear end. That's true. But do you get up, and do you get up smarter? And that's the moment we're at. One of the lessons we learned, and I was speaking about it in the hearing today, we should never again be in the position where we don't have medical equipment, where we're facing a pandemic, we're facing a major public health issue, and we don't even have basic equipment for nurses and doctors. And so much of it came from China, and governors such as myself are trying to figure out who do we know in China to get masks for nurses in our hospitals. I mean, it was terrible what we went through. It's a matter of national security. And I want to make sure that we in New York are actually leading the way. Let us start manufacturing here in this country, in this state, masks and gowns and drugs and the ventilators and the tests we need. And let New York start, and we already have. But we should never again as a nation have to scramble the way we scrambled. We are now aggressively courting businesses, incentivizing businesses to build, to manufacture medical equipment here in this state. And the state will partner with corporations to do that. So if you want to start, grow your business, expand your business, manufacturing masks and gowns is not the most difficult situation technologically. The volume is the problem, the quantity. But we want to develop that here in this state. And then with this virus, we must remain vigilant because we're still learning. Facts are in many ways still continuing to change on us. And while we're learning, the virus is still learning also. We have a situation that is serious and concerning, which is these COVID-related illnesses in children. Department of Health is now looking at 110 cases of a COVID-related illness in children. It's similar to what they call Kawasaki disease or toxic shock-like syndrome. We've lost a 5-year-old, a 7-year-old, and an 18-year-old girl to this disease. New York State and Department of Health are at the forefront nationally, if not internationally, in looking at this. And the Department of Health, good work of Dr. Zucker, they've had a number of telephone conferences, web conferences. 16 other states now see cases that they're investigating once Department of Health explained what they've been looking at. 6 European countries are now looking at the same situation, and I expect this is only going to grow. Parents should beware, and parents should be informed of this. The key is prolonged fever, and then you see on the chart the other symptoms that parents should look for. Also, it tends to present in children who were exposed to the COVID virus and actually now have the antibodies from the COVID virus or still test positive for the COVID virus. So if you have a child who has a fever, who you think may have been exposed to the COVID virus, a person who had the virus or you found out later came down with it, and you see these symptoms, then you should take action. New York State has published today online the first in the nation criteria for healthcare professionals to isolate, define, identify this syndrome, and test for it. But it is very important. Right now we have it affecting children from less than 1 year old, so infants to 21 years old. Okay, that's it. When you look at over the 100 cases, that's the span, which is obviously a very frightening development. There's more information on the website. Last point of personal opinion. I'm the governor of the state of New York, and I take that responsibility very seriously. I'm honored to be governor. I work at it 7 days a week, 24 hours a day. But in many ways, before being governor, I am a son, I'm a brother, I'm an uncle, and I'm a father. And as a parent, as a father, I just want to make sure I'm communicating, especially this last situation, to the people of the state and beyond. This virus has been ahead of us every step of the way. I can't tell you how many quote-unquote facts I was told that then changed, right? When the virus started, the virus was coming from China. Everybody was looking at China. Turns out the virus came from Europe, and nobody told us. When this first started, if you had the disease and recovered, you then had antibodies, and you were immune. My brother had the virus, recovered, so he had the antibodies. We were told, well, then you're immune from getting it again. And we had plans to have people who tested for the antibodies, they could go back to work because they were immune. And the facts changed. You know what? Maybe they're not immune, or maybe they're only a little immune, or they're partially immune. Then we were told children are not affected by the virus. That was the only good news, by the way, in the whole first evaluation. Children aren't affected. Okay, now maybe children are affected, and we just didn't know it. Okay, well, what do we know now? Well, we're studying 100 children from 1 to 21. Okay, Michaela, my daughter, is 22. Well, we only have people up until 21, so she's okay. Yeah, until we have someone who's 22, or 23, or 24. So the facts change. I have done my best to give people the information that I know. But I want you to have the same caution flag that I live with. The facts on this virus have changed, and I believe they will continue to change. So take this all with a grain of salt, and my basic point is, do not underestimate this virus. It has beaten us at every turn, and it has surprised us at every turn. Don't take it lightly. Don't underestimate it. I believe the facts will change as we go forward. The more we learn about the virus, the more the facts change, and the worse it gets. There has been no news since we started this where we were actually too cautious or too concerned. All the news has been bad, as far as I'm concerned. So with all this information, with all government is doing, hearings in Washington, all this, you know who's going to protect you? You are. You know who's going to protect Michaela, 22 years old? Michaela being informed. Michaela understanding. I like to think with a little advice from a parent, which she discounts 99%, but maybe 1% of the advice communicates. Michaela's graduating from college this year. They closed the college. She said, you know, a lot of people are having parties and they're having graduation light events. Should I go? You know, 22, you can't tell them anything at 22. I couldn't tell them anything at 21, 20, 19. But I said, well, here's the facts. This is what we know. And is it worth the risk to do it? And Michaela's made all the right decisions. But every parent, every child, it's your job to understand and protect yourself. And I just urge caution, because everything I say, I tell you everything I know. But I'm also telling you there are things we don't know yet. And how do you protect yourself from those things? Just be cautious, be diligent. Wearing a mask, wearing gloves, staying away from gatherings. I know they're inconvenient, but God forbid, you know, just God forbid. I've talked to too many families who have lost people. I've talked to too many families who lost people who were not supposed to be lost to this virus, right? This was just about vulnerable people, senior citizens, comorbidities. Yeah, but then how do you lose a 40-year-old who had no symptom of anything, right? Children were not affected. Yeah, until children are affected. So, caution to everyone. And whatever I know, I will communicate. But again, it's about you, protecting you, and I heartily recommend caution and diligence. Questions?
Governor, the state website today posted what looks like guidelines, a breakdown of industries for phase one, and basically an agreement businesses have to fill out. Would you explain that process, speak to business owners across the reopened regions of the state about what they need to do?
Yeah, let me give you the general outlines. Melissa or Gareth or Dr. Zucker or Michaela can chime in. The phased reopening, phase one reopening for regions that hit certain numerical criteria. We talked about what regions are poised to hit that criteria tomorrow. And then with the phased reopening is construction jobs, manufacturing jobs, retail jobs by these guidelines. And the guidelines are posted, and the guidelines are quite specific: social distancing, curbside pickup, in-store pickup. If you're a manufacturing facility, 6 feet, PPE provide to employees, et cetera. Those guidelines are then enforced and monitored by the local governments. To the extent there's any question for a specific business that these guidelines don't exactly fit, how does this work? They can call the quote-unquote regional control group, mayor, county executive, their local county executive, because they're going to be in charge of the compliance. And we understand one size does not fit all, so depending on pound of business, it may have to be customized, and how do I interpret 6 feet? This is how my business works. It doesn't really fit 6 feet. All those one-off issues, if you will be handled locally. We just have statewide overall guidelines, and any particular tailoring question, that should be done with the local governments. You want to add anything?
No, that's correct. And we posted it, as you noted, last night. Today, we're doing our regional control meetings with the state to be able to answer questions of all the local leaders that will then get passed down to the businesses.
Is there a backside to the process? Does the state or a local control group have to approve these filled out agreements by the businesses?
This is the way that they demonstrate that they're adhering to the overall guidelines, and then it can be a check on the business afterwards. You said that this is the way you're going to maintain social distancing, that you're going to create a safe environment for your workers, and then if there's an issue on the back end, then you have the plan that they said that they were going to adhere to, and it's a way to hold them accountable.
Region, we've had about a week to prepare for reopening, and the phased approach is mostly for businesses and things like that. We're getting a lot of questions from people about social acceptability. Since we've demonstrated that we can be responsible and keep our infection rates down, is there any leeway from a social aspect? Can people go to their grandkids' house if they keep their distance? It seems like a lot of people are desperate for some social interaction.
Yeah, look, there was never a law on social interactions, right? How I interact with Michaela is my business. I could have gone, I passed Matilda's law. Matilda's named for my mother. I have not seen my mother since this started, except on video devices. I could have. That's up to me. You know, this is your relationship, it's your interaction, it's your family, it's your friend. You know, we have guidelines, we have best practices, we can tell you what we think is smart, but that's up to individuals. And that's why I say inform yourself. I suggest caution, again, because this virus has only gotten worse the more we know. But there's no law or regulation that tells you how to interact with your personal relationships. That's up to you. I hope you do it smartly, but that's up to you.
So how do you see Americans looking tomorrow when they wake up and they're in phase one?
The businesses that choose to open, big question is how many businesses, big question to me is how many businesses choose to open tomorrow. But you know, for those businesses that choose to open, this is how retail stores will work: curbside pickup or in-store pickup, and then you can get the details on that. Manufacturing companies that want to open, this is how their employees, the PPE their employees would have to get. This is how it would have to look in the workplace: no gathering, social distancing, et cetera. And then we watch the numbers tomorrow, and we see with that increase of activity, how did people behave, and what was the effect on the infection rate, and then we go day to day.
Governor, religious leaders, a lot of them I've talked to are feeling left out because they're not mentioned anywhere in your 4-phase plan. Now, while you didn't specifically close churches, I think a lot of them are looking for guidance. What can you offer to churches, temples, mosques as far as guidance for when they can start to reopen? It's less about being a church, a temple, or a mosque. It's more about a gathering, and that's going to be basically according to the guidance on large gatherings. But look, large gatherings
have been where this first started. You know, we had the first quote-unquote hot spot, before they even called it a hot spot. We had the first big cluster in New Rochelle, in Westchester. There was no reason for it to be in New Rochelle and Westchester, suburban community. It was because one infected person went to a couple of events around a religious ceremony. But the last thing you want is 100, 200 people in close proximity. That is the last thing you want. That's why schools are such a challenge. How do you operate a school without a gathering? But that's the issue on the churches, temples, mosques. It has nothing to do with religion, it's the gathering.
In regards to the Madison County outbreak at Green Empire Farms, more than half of the workers have tested positive, some living floor to a hotel room. One worker just lost her husband to the virus, and the company isn't answering our questions. Are you getting answers, and what are you doing to protect the community and the workers?
Yeah, there are a number of outbreaks across the country in meat processing plants, right? So there are all these stories, this meat processing plant, this meat processing plant. Then we had an outbreak in an agricultural plant. Well, what was it about meat processing? It had nothing to do with meat processing. And by the way, it had nothing to do with agricultural processing. It was the fact that you had 1,000 employees in one plant. It is the gathering issue. What they call a super spreader. One person in a large gathering, any density, can infect dozens. That was New Rochelle and Westchester. Literally dozens in one event, in one gathering. That's what we learned in New Rochelle. That's what they learned again in the meat processing plants. That's what we just learned again in Madison County. So it is about the gatherings. Now, they have several hundred employees in one place. Yeah, one infected person, it can take off on you. That's why all the precautions. 4 people in one home, yeah. What we're seeing now with a lot of the new cases, they're coming from home spread, right? Close down businesses, close down schools, et cetera. So where is it now communicating and growing? In the home environment.
Madison County said that the facility wasn't able to continue construction of its housing for these workers, so they then put them in hotels. So the coronavirus displaced their project, therefore they had to live in hotels, kind of a full cycle of why the density was the way it was.
Well, if you have 4 people to a hotel room or 4 people to a home, you know, it's going to be the same thing. It's, you have one infected person in the home, you see it go through the family, right?
Should something have been done differently, though, if they don't have places to stay, not put them in a hotel?
Well, you have to, people have to live somewhere, but it's not unusual to go through a family. My brother Chris had the virus. His wife got the virus, probably from Chris, though he denies it, but then his son got the virus. Why? Because they're all in the same place. Dr. Zucker, you want to add anything on that?
I think it's just, I would just add that we have been working with the county to address the housing arrangements and working with the employer.
Will you be holding them accountable if the company, find out the company hasn't been?
We are investigating everything, yes.
Governor, question for you about.
You know anything?
No, I was just going to add that this speaks to the whole reopening process, right? This is why it's so critically important that we're measuring on a daily basis the infection rate, the hospitalization rate, that we have proper testing, that we have proper contact tracing in place. Because if you look at the Madison County example, there's one instance and then there's an explosion of cases in one area, and you need to be able to test to find out whether or not those people are sick. You then need to be able to isolate them. You need to be able to contact trace to find out who else they interacted with, or else we go back to square one, and I think we can all agree no one wants to live through this again. So it just underscores the importance of doing this reopening process smartly, of every employer who's starting to reopen or is currently open, doing this in a way where social distancing is properly done, where we're making sure that everyone's wearing masks, where they're wearing gloves if that's possible, and that we do this smartly and we do it the right way.
Yeah, and one of the points to learn from Madison County, I think, You know, it's too easy for people to say in more rural communities, well, this is not our problem, right? This is a city problem. This is an urban problem. This is New York and Detroit, New York City, Detroit, it's Michigan, it's Chicago. No, it's Madison County, which is a rural county. You open a plant, you open a business, you go to a gathering, you have one person infected. One person infected, they can infect dozens in one afternoon. One afternoon. I don't care if you're a rural community, suburban community, urban community, nobody is immune. That's what Madison County says. That's what these meat processing plants in Middle America say. In rural communities, one person. You open a business tomorrow with 50 employees, you don't do it right, one person was infected, you can infect 30 of the 50 in one afternoon.
As businesses begin to reopen in phase 1, 2, whatever, is there a liability if there is an outbreak at those businesses, and should that be waived?
There's federal legislation that is now pending that's going to deal with this liability issue all across the board, but it is a big question. If I'm advising the business owners, I say make sure you take all the required guidance and you follow the guidance. And the guidance is quite specific. So I would urge that they all do that.
No, and part of the business reopening plan, as you're noting, is something that you have to turn in to attest to the fact that you are adhering to the guidelines. And so if businesses aren't doing that, to the governor's point, I think that they do that at their own peril.
Let's take one more. Someone who didn't ask a question, sir?
Surgery centers, eye doctors, dentists, what phase do they fall in? A lot of people are asking when they can go get their eye checked for maybe for a driver's license, toothache, whatever. Dentists, eye doctors, surgery centers, what phase do they fall under?
Just so you know, driver's licenses, et cetera, you can do transactions for the Department of Motor Vehicles on a website. For the in-person transactions at a Department of Motor Vehicles, which are basically license renewal where you need an eye test, something like that, those deadlines have all been suspended. So if your license expires or if your vehicle registration expires and you had to go into the DMV, no one is going to enforce those laws until you can go into the DMV. So we suspended that. The elective surgeries in many counties upstate have all restarted. The doctor's appointments, doctor's offices can operate with social distancing. Ambulatory services are open. You know, people who need medical attention or medical treatment should go get it, right?
Governor, on the state fair, you've already said what has to happen regionally for that kind of event to be held. But with the Syracuse Nationals coming before that at the fairgrounds, and then the state fair needing to be planned, what's your confidence level that the status of this virus will be in check for those events to be held?
Yeah, I am not going to guess, and all it would be a guess, and I'm not going to do that. This situation changes every 2 weeks. And that's why I want to do this caution, and I want people to hear me, because I don't want them to say, well, the governor said, which I did say. I said, we don't believe children are affected by this virus. I said that. I said that a number of times. And I'm talking to the best public health experts on the globe, and that's what they told me. And that's what I told people. And now that turns out not to be true. I'm very wary of that, right? And I take that responsibility very seriously. Because when I say it's a fact, I present it as a fact, and a fact is a fact. What's happening here are facts are changing. So to say, here's what I think is going to happen in 5 weeks, 6 weeks, 8 weeks, this is where I think we are going to be in September for schools, no, burn me once. I'm not going to guess. I'm not going to opine. We'll make the decisions when we have to make the decisions, because for planning purposes, et cetera. But let's see what the facts are at the last minute that we have to make a decision.
What's the last minute for the Syracuse Nationals or State?
Well, they have to tell me when their drop dead date is, that I would have to know by this date.
I'm under the impression for the Syracuse Nationals, that's tomorrow.
Well, they haven't communicated that to us, but, give me the drop dead date and I'll make a decision based on those facts at that time. And then if they change, they change. But I want to make sure we're using the best information we have, and we are in a situation where the information keeps changing. And look, there can be positive information also, right? There could be a medical breakthrough and they announce that they found a therapeutic model that actually treats the virus. So there can be good things that have developed, that develop also. Just hasn't happened yet, but there could be.
One housekeeping question. 12:01 Friday morning or 12:01 Saturday morning is when a region can reopen.
12:01 Friday morning, the 15th, is when New York on pause expires.
Friday can be a day of business.
Yep.
There's a lot of confusion among professions that are in phase one about which phases they're in. Hairstylists, professions like that, they think they're phase two. Do you have an idea of when you might have a firm list of which professions are in which phase?
I hadn't heard that question, but we can do that.
Do you see hairstylists as phase two?
I don't know that I'm qualified to opine on that, unless you're saying I need a haircut really badly, and then we'll talk about it. But we'll get the information. We also will have daily calls with the Regional Control Council. The mayor and the county executive are here today. And a lot of this is going to be locally managed, so we'll be working with them. But, the state, one of the beauties of the state, we have 10 different regions. Each one is a little different, right? So each one of these situations has to be tailored to that community in that region. And that's why the county executives and the mayor are going to be so important in actually making it work in each region, and we'll be working together with them.
So it's possible that different professions could be in different
Well, no, a
phases.
hairstylist is going to be a hairstylist is going to be a hairstylist. I just don't know where a hairstylist falls. So I'm going to gracefully and artfully look to dodge your question on hairstylists until I can go back and get informed, and then I will have someone give you the answer. Thank you very much, guys. Thank you. Thank you.
In-person DMV, is that phase one or two?
I'm sorry?
In-person DMV services? Phase
That's
one?
not a phase. That's when we make a decision on which government agencies to open when. And we'll have a full list of the professions, hairstylists included, and what phases they're in.
When you see kids in events like camps and playgrounds and dance lessons,
Same thing. They'll all be, they go by region. Camps go by regions.
so that's their decision?
To members of Congress, Republican members of Congress from New York calling for an investigation into the nursing home situation in New York?
Look, everybody, I would like to say that we are enlightened enough where this is going to be a period where we don't play gratuitous politics. But everybody makes their own decision. Thank you, guys. Thank you very much. Good to see you guys. Thank you. Thank you, Mr. President. Thank you.